My name's Rebecca Tudor. I'm one of the Service Improvement Business Partners at Shrewsbury and Telford Hospital. I'm going to talk to you today around the pre-assessment work, information leaflets that our pre-assessment team have created. Unfortunately, neither of them are able to join us today. So although I wasn't directly involved in the project, I have supported them through it. So I'm just going to talk to you about roughly the work that they've done as part of that. So the two ladies that were mainly involved were Rachel Bollins and Rachel Bladen. So they are part of our pre-assessment team. And initially at the start, they were looking at their pre-assessment packs. And for our patients, we created two different types of packs. So we had a day case pack, which consisted of 7 leaflets, and an inpatient pack, which consisted of 8 leaflets as well. So under normal circumstances in a normal week, they distribute around 100 packs to the patients each week. So each pack is printed by our clinical teams, and they were collated prior to presenting to the patient when they came for their appointment. So that takes quite a lot of time, and it's quite costly as well, and obviously has an environmental impact. So the team used to do it in batches of 50, which takes around 60 reams of paper and 2 to 3 hours per pack that they generated. So the aim of the pack is to give the patients the relevant information that they needed to know as part of their procedure and their operation. There's quite a lot of information for patients to receive at that point, and the team felt that it was quite overwhelming having 7 or 8 different leaflets all in one go, and that was it felt that that was quite a lot of information for people to take away and digest, and actually was that the right kind of way to do it. So the idea was that they wanted to look at how they provided those leaflets to the patients in order to kind of make it so that the patients got what they needed, while also having a look at whether there was a different way that we could do it to kind of modernise the work environment, reduce the paper wastage, and then free up time as well. So as the pre-op assessment department, they wanted to look at how they restructured their appointments to be able to get more people through the pre-op assessments. So by freeing up the printing time, in effect, they were able to release that as part of the extra clinical time that they needed to see the extra patients that they wanted to do. So the idea was that they wanted to create around an extra 100 appointments a week, which obviously if you're spending 2 to 3 hours a week on printing, that's quite a long period of time as well. So what they did was have a discussion with the patients. So Rachel Bollins had attended our training course, and through discussions throughout the day, she said, oh, actually, I think there's something that we can do with our pre-assessment leaflets. So they had a discussion with the team around different ideas and things that they wanted to test, and somebody suggested the QR code to see if they could do that. So the idea was that they wanted to trial the use of QR codes for the patient information leaflets. So they initially engaged with our patients, so they asked lots of different patients, lots of different questions to see whether QR codes would be something that they would be interested in. The initial feedback was that yes, most of them would be happy to trial the QR codes. So then they started working with the comms team to design what that leaflet would look like. There was a lot of work that went on in the background as well, because some of our leaflets are on a system called IDO, which needed a few different licensing things looked at. So once they'd got all the permissions from all the different places, they designed this lovely leaflet that you can see here that's got all of our QR codes on for all the different leaflets that they would have had. So when our patients came in, they did a trial at the beginning of August to ask patients whether they wanted the actual leaflet pack or whether they wanted the QR code leaflet pack, and they recorded what types of patient took the QR code and what type of patients had the leaflet. So the opportunity was still there to have the leaflet pack if they wanted to, but if they just wanted the one sheet with all the QR codes to look at in their own time, then they could have that instead. So they trialled that over August, and initially about kind of 40% worth of the patients had the QR code, but then as the weeks progressed, that moved up to about 60 or 70% of patients having the QR code. So that made a massive impact in terms of the printing time that they needed, an impact in the paper that they've saved, and obviously the costs of the printing as well, and that freed up the extra time. So that's something that they're still they're still continuing with at the moment. And any of our patients that want those packs can have that instead. So in terms of next steps, they're continuing to offer those QR codes for our patient groups. They're looking at how when they're booking in the appointments and looking at the patient kind of demographics and ages to see how many information packs they need to print and then how many QR code leaflets they need to print, and they're using that to kind of base the printing that they do. And the next steps in terms of that is looking at whether they can use the QR codes to get the leaflets printed in different languages as well. So that's kind of the next step. So that covers all of our patients and how we can get that information accessible to them. So hopefully I've done that justice for the Rachels. Has anybody got any questions? Tanya?
You said you was collecting details off the patients. But, part of that is just a question really. Did you cover all the protected characteristics to see how that impacts?
Not initially. So they were just looking at the age ranges initially. So that's that next piece of work. So we're also looking at in terms of accessible information and those protected characteristics. So that is that next piece of work. But initially in that first kind of draft, we were just looking at what age patients wanted the QR code, and that was it really.
Yeah.
Does that answer your question?
Oh, yeah, it did. And then, if you don't mind, can I ask one more question?
Yeah, of course. Yeah.
What about easy read? Have you done easy reads? People plain usage of language.
Yeah, so when on our intranet page, when you scan the QR code, there is an easy read format within our kind of SATH website. So I've had a quick play with it myself. I do believe that you can just press the little person and then it makes it easy read for people. So that is something that you can do, but obviously that it just covers kind of the English language at the moment.
That's great. Thank you. Thank you.
Thank you. So just having a look in the chat. So Amy's asked if there's information on the uptake in the older patient. Yes, there was. I think as you would expect, a lot of more of the uptake has been kind of around the younger patient, but we have had uptake within the kind of 70-year-old and above age range. Not as many, but there has been an uptake there. So, but the patients have still got that option. If they want the hard copies, they can have that as well. So hopefully, Amy, that answers your question. I could send you the information if you wanted me to. So I've got all that breakdown if you wanted to see kind of figures.
I've just got a quick question, Rebecca.
Yeah.
Sorry, I haven't got my camera on. It's a bit rude. I wondered whether you'd worked out how much the cost saving had been for this. I know that wasn't your primary reason for starting it, but I just wondered out of interest because it sounds like it could be quite big.
Yeah, it is. I think it could be quite big. So I haven't got my spreadsheet to hand at the moment. But if you think a ream of paper is kind of about £4 or £5 per ream, and they were using around 6 reams per week, plus your printing costs of sort of 5p per page, plus the staff time as well. So that there has been quite a lot really in terms of savings, although we haven't managed to collate it fully at this moment in time. But that's something that we're going back on the budgets on their finance reports to have a look and kind of quantify so that we can see.
Oh, they'll be very excited, and I bet you don't see as much of the photocopier engineering now either.
No.
And then I just noticed Heidi had said about the carbon emissions, because I went to the session earlier in the week when they were talking about the cubes of emissions. I'm not sure of all the technical terms, and then they use some comparisons like it'd be like traveling however many hundred of times in a car from London to Glasgow and back, and I think that'd be really interesting to see for this project as well, because of I know paper and printing, and it does involve a lot of chemicals and things like that. So I bet there is quite a high carbon cost that you're saving. So it'd be really interesting. But like just looking at that on the screen, it looks really user friendly and very inviting to use. So well done and great project.
Yeah, thank you. And they do test it every day as part of their huddle, just to make sure the codes do still work, so that obviously they can pick it up quickly if something isn't quite working as it should be, so they can get all that sorted as well. And like we said, we're going to try and do the same for getting it in different languages as well, which would be amazing. So
Brilliant.
Just looking at thank you. So just looking at the questions in terms of the change for the service, so it's given some of that time back really that the healthcare assistants and team would have spent doing that printing, so that's given them time to be able to keep up to date with their mandatory training and actually fit in those extra slots that they needed to and provide that patient care. So that's still what we're looking to quantify that at the moment. So they've been kind of doing it for 2 months now, but it's just trying to pull everything together and monitor over the next kind of couple of months really to see what the overall impact is for that. Just having a look at the other questions. So in terms of the balancing measures, we haven't seen an increase in patients not being properly prepared for their operations. So that was something that we were looking at, and that was something that they were capturing as well. So as far as I'm aware, there haven't been any negative effects around that, which is brilliant, because that was something that we said was really important, to make sure that the patients were actually reading them and they weren't going home and then having not read them by the time they come in for their operation, because obviously that's really important. And there's another question around, do you know of any use of QR codes for cancer patients? I don't personally, but that's something I can try and follow up on. I know our radiology department use QR codes for their leaflets, and they do theirs in different languages as well. But yeah, at the minute, I don't know if we do for the cancer patients. So Tanya, you've got your hand up.
It goes back to that Jingo's question. The patients that are ready, have you looked into the ones that aren't ready, and also look at the protected characteristics of that? So you can sort of like check there's no sort of, what's the word, theme there of the people who aren't quite ready. So yeah, does that make sense?
In terms of ready to use the QR codes, do you mean, or ready for their operation?
Ready for their operation, those who aren't ready but have had the QR codes.
Yeah.
And how that relates as well.
I'm not sure. I can take that back and ask that question. Personally, I don't know the answer to that one.
That's cool. That's cool. It's just something to think about.
Yeah, no, I think that's really important. But I can feed that back to the team as well. So
yeah, and look at socio-economic status on that as
Yeah.
well, because I know that was taken out.
Yeah.
To call it. Brilliant.
Perfect. Thank you. Okay, so I've just seen a comment in there around calculating the carbon impact. So thank you. That would be really helpful. I'll have a look at that after as well, because it's really nice just to pull it all together for the same kind of piece of work, really, so we can demonstrate across all elements, and then that helps us going forward if we're doing anything else with any other departments. If we've got that information before we start, at least we can gather it all together. So Hayley.
Hi, I was just going to ask, have this kind of been spread into any other departments in the hospital? This is something where I work, we're wanting to look at doing this in ED, because there's so many guidelines and lots of documents and all sorts in that department. We were looking at doing it from a staff point of view. If you need to know some of the key staff guidelines and policies, could we have some QR codes? But we ran into a stumbling block because they were all on our intranet, and it was really hard to get a QR code to link to an intranet because you can't get on the internet on a mobile device.
Yes.
But yeah, I'm just wondering whether this has been kind of taken up by anybody else across the trust, and has it kind of spread beyond the original place it started?
So there are other areas that use it. So the way, in terms of your intranet comment, the way we got around that was putting a page on our SAT actual website. So we didn't need to use the intranet because it was on our actual main SAT page. So obviously anybody can access that. In terms of kind of the spread, other areas do use it and do use QR codes, but I'm not sure whether anybody's kind of looked at it as a result of this or whether it's something that they were looking at separately. So, but that's certainly information that I can try and find out.
Yeah, that makes sense. Yeah, I was just wondering really, but yeah, it sounds like a really positive, but and simple. I like simple ideas that sometimes are really effective. So yeah, that's great.
Yeah, and we've taken a lot of learning from this as well. So it's then if anybody does come to us, we can refer them to the right place, and it should save the legwork for anybody else wanting to do it. Thank you. Tanya?
So this one's about other trusts and other hospitals and what they're doing. Is there like joined upness? Because I've got to go to Manchester and I'm absolutely amazed. It's all online. Well, it's all available online, like a patient portal. So they send you messages, they'll drop you an email, so there's a message in that patient portal, all your appointments are in there.
Okay.
And it's absolutely amazing. It took me a while to get my head around it, but yeah, it's absolutely amazing. Even letters, everything is just there on that one portal.
So you've just prompted me to think about something, so that our booking teams are looking at using the QR code as part of their letter to be able to put the additional information in that rather than having 10,000 different pages as part of the letters. I think we're perhaps not as technologically advanced, I would say, as Manchester at the moment, but I think that's probably something to bear in mind for future. And then any learning that we take, we can build that in as well. If somebody's doing it well, we don't want to reinvent the wheel. It is about kind of taking any learning that anybody's got and building it into what we do. Does that answer your question?
Yeah, totally. Thank you.
Anything else from anybody else? Yeah. So I have got an evaluation form on the screen, which is a QR code as well. So if you want to scan that and complete that for me, that would be brilliant. But thank you all for attending today. It's been really lovely. And if you do want any more information, just please contact us afterwards. I think this information and recording is going to be available after. But I know the pre-assessment team will be more than happy to speak to anybody if anybody wanted to do something similar in their areas and wanted any kind of questions answering. Thank you.
I just want to say thank you. This is a really good session.
Thank you.
I just say one thing as a patient to all you guys. Thank you. With everything that's going on in the NHS, I'm a service user, and a lot of you will know that. I just want to thank you all. You know, you're all working so hard and so dedicated. It's amazing. Amazing.
That's really lovely. Thank you. It's always nice to hear as well in terms of patient feedback if there's anything that we can do better. And I'm assuming you might be a user of our hospital as well, given where you live. So if there is anything that you think we could do better, then just let us know.
Absolutely. I mean, it's just
Thank you.
Bye.
Thank you. Yeah, so I'll stay on for another couple of minutes. If anyone's got any more questions, then feel free to ask. If not, then you're free to go. Thank you very much for joining us.
Hi, Rebecca. I've got a really quick question, if that's okay.
Yeah.
I popped it in the chat and then my internet dropped off, so I'm not sure if
Sorry.
you've already answered it. No, you might have answered it, and I'm just I thought I'd just quickly ask it. But I had a question about just balancing measures and whether when you sort of implemented the virtual leaflets, whether there was any sort of uptick in people attending and not being, prepared, so not having read the leaflets. Was there any of that?
Yeah, so that one we did kind of talk about.
There
hasn't been, no, it's fine. There hasn't been any kind of negative feedback around that yet, because that was something that they were looking at. But that's obviously something that they'll need to continue to monitor as well. But at the moment, no, not yet.
Amazing. And I suppose
hopefully not at all.
Yeah, I suppose if they've got an option to go with a virtual leaflet or a paper leaflet still, it's whatever you're most comfortable with. So hopefully people are always reading it. So yeah, brilliant. That's really good news. Thank you.
And the contact information is on the QR leaflet as well. So if they did want to speak to somebody about anything, they can ring the team to talk through anything. And then if they wanted the packs, we could send them out.
There's loads of fail safes basically that they would get information somehow. Yeah. Okay.
Yeah.
Thank you.
Thank you. We tried to cover every option.
Brilliant.
Thank you.
I'm going to hop off, but thank you so much.
Yeah,
for that.
thank
was really
you.
Insightful.
Thank you very much. Thank you.
Bye.
I'm off
Bye.
soon now. Bye bye, everybody.
Right. Thank you very much.
God
Thank you,
bless all of
Tanya.
you. Bye bye.
Thank you. Bye.